Photorejuvenation uses laser to treat pigmentation and vascular imperfections, such as sun damage and rosacea. Light pulses penetrate the skin and create heat, targeting the unwanted pigment or blood vessels in a controlled manner. The body's natural process then breaks down these areas over the following weeks, resulting in improvement to the overall skin tone. We have a variety of different lasers and light sources for photorejuvenation. Your provider will determine which is best suited for your skin and concerns. During each treatment, ultrasound gel is applied to the area and the light is delivered in quick pulses. Each pulse feels hot and sharp. Cold air is blown to help with this discomfort. The treatments are quick, taking only a few minutes. Some conditions only require 1 or 2 sessions, whereas others need a series of 3 to 5. These treatments are spaced 4 to 6 weeks apart. Redness and swelling can be expected following the treatment and will resolve within a few days. Treated brown spots may darken and slough off within a week or so. You may apply makeup and return to your normal activities the following day.